The Centers for Disease Control says the flu is widespread in 44 states, including here in Indiana. And according to our local Allen County Health Commissioner, this year's strain is more severe, sending many to the hospital. That's especially true for many seniors. Jim Sullivan with Home Instead Senior Care is here to explain how hospitalizations for seniors during winter can be prevented. Jim, thanks so much for being here.
Thanks for having me.
First off, what is the main reason for seniors going to the hospital?
Well, there's a couple reasons actually. Obviously illness, things like flu, shingles, pneumonia, and this is the time, January, February, March are the biggest seasons for obviously the flu season and some of those illnesses. And also just things around the home. Falls, of course, are always another big reason for seniors going to the hospital. Okay.
And when you think about the flu, I mean, you think, okay, maybe it's just the flu, not severe, stay home, or sometimes, they try to overdo it. How can going to the hospital be prevented?
Well, some easy things actually. Nurses surveyed, 99% of them said that family intervention is one of the best ways, and in fact is as important as the health care community in preventing seniors from going to the hospital. So it's really things like looking in on them, encouraging that they use assistive devices, of course getting flu shots, pneumonia shots, those kind of things, and monitoring medications, visiting the doctor with them to get through some of that complicated information, because a lot of times seniors are kind of in denial about their health issues or just put it off, and those are some really big reasons why seniors end up in the hospital.
How does this year, I don't know if you have this specific statistics, but for you all, how does this year compare to other years? I know it's been really bad this year.
It's always an issue. I mean, we deal primarily, obviously, with seniors. We do have some younger clients and all that, but it's always an issue. This year, the flu obviously has been particularly, serious because the flu vaccine was not quite as effective this year, and so more seniors seem to be having those kind of issues. And then with respiratory things, the pneumonia comes up, and that becomes a serious issue.
Okay, so as for people who are watching and their mother or dad, they're seniors, their grandparents, your number one piece of advice, if you could tell them.
Be proactive about your loved ones and get involved. I mean, a lot of times things get lost in the shuffle. So, a lot of times they'll put things off. They don't want to go to the hospital. And you don't want to go to the hospital because you can also get sicker in the hospital sometimes. Unfortunately, that's where a lot of people are that have illnesses. So be proactive. Check up on them. Just check on them. Monitor their meds. Monitor what they're doing. And offer good, gentle suggestions and take part in that. That's the best thing.
Thanks for your help, Jim.
Thank you.
And you can head to homeinstead.com for more information.